Ingram. This is Ingram Angle from Washington tonight. Now, we're going to be examining the shifting goalposts from the meaning of flattening the curve, remember that, to whether we should wear masks in public. How can the public be confident in what they're hearing from the health officials if things keep changing? And how do you explain the huge disparities in the cases and mortality in New York versus California? Two highly respected doctors in each of those states will tell us. And also tonight, what will the bar and restaurant experience be on the other side of this? John Taffer of Bar Rescue, don't you love that show, is here with some insights and tips. And Joe Biden's media appearances this week haven't inspired a heck of a lot of confidence. Raymond Arroyo is here for Friday Follies to break it all down. But first, my thoughts at the end of day 32, if you can believe it, America in shutdown. Now, as more COVID-19 data keep pouring in from across the globe, many key questions remain unanswered. Now, the answers to these questions are going to tell us how lethal this virus turns out to be, whether mutations affected its virulence, and whether government shutdowns really worked. And then finally, how should we proceed going forward? Now, first, we have to remember that much of what we were told about this virus at the outset turned out to be wrong. Of course, China lied about its origins and engaged in a massive virus cover-up, with, of course, the help of the World Health Organization.
This could have been shut down a long time ago. They knew it, and we couldn't get in, and in all fairness, World Health couldn't get in, and that's why I wish they took a different stance. They took a very pathetic stance and a very weak stance, but they say they couldn't get in. But ultimately they got in. They got in much sooner than anybody, but they didn't report what was happening. They didn't report what was happening inside of China. No, I'm not happy with China.
And trillions of global wealth and thousands of people have died as a result. And even now, the communist regime is still not giving us what we need. Do we have all the data that we want from China? What about that primary data about patient zero and all that key data about the therapies that they've used?
No, I mean, I think any of us who have been dealing with this now for the last few months don't feel confident at all that we have all of the data of the originally infected individuals, how long there were people in the circulation, or even now, how many deaths there really are in China.
Well, that's somewhat of a change from what Dr. Fauci said back in February when I asked him a similar question.
The WHO has finally gotten a team of people, an international group, to go over there. So they're going to have eyes, ears, and boots on the ground to be able to look and verify these things. So right now, at this point in time, I believe those numbers.
Well, the simple question is this: what is China hiding and why? Now, they still haven't come clean about patient zero, something I've been clamoring about now for 2 months. At this point, we don't know the origins for sure, but China can't even tell us patient zero's name or anything about the first victim of this virus. We want to know everything about patient zero. We still don't really know about patient zero in China. A lot of that data is being withheld still from the United States. Now, today, China revised their numbers of COVID deaths in Wuhan from 2,579 up to 3,869. That's an increase of 50%. Can we believe any of this? But let's stay on track here. For some reason, few people seem to be asking a lot of different questions that stem from this first origination of the virus. For instance, why New York's COVID death numbers are so high compared to other cities, including China, Chinese cities outside of Wuhan and in countries neighboring China. As of today, New York, a state of 20 million, has a staggering 12,192 coronavirus deaths, or 63 deaths for every 100,000. Now look at this chart. New York City has seen, of course, 8,632 deaths, or 102 per 100,000 people. Yet in Beijing, with a population of 18.8 million, it's only reporting 8 deaths total, or 0.04 per 100,000 people. In Shanghai, only reporting 7 deaths, or 0.03 deaths per 100,000. In Tianjin, it's 3 COVID deaths, or 0.02 deaths per 100,000. This is totally weird. That's the nice way of putting it. Well, Beijing shut down for about 2 months. Shanghai and Tianjin were also locked down for many weeks. But before they all shut down, millions were allowed to move in and out of Wuhan and the greater Hubei province. New York will be shut down for at least that same amount of time as all these major Chinese cities. Again, the disparities in these numbers must be closely examined. When you look around the world, New York City has a higher COVID death rate than every country in Asia. Check out India's numbers. It's a country with 1.4 billion people. We're a country of 330 million people. We have 37,000 deaths. India is reporting 486 deaths. Look at Japan with only 190 deaths. What about Pakistan? 135 deaths. What's going on in these countries? Is it a lack of testing? They don't have all the testing that they need? Does the widespread use of anti-malarials in some of these countries play a role? Russia closed its border with China pretty fast. Was that dispositive? Russia only reports a total of 273 deaths due to the coronavirus. Now, if I were Andrew Cuomo, I would be on the phone with the leaders of all these countries and the major cities that we reference every day to learn about best practices, if those numbers are real, best practices against the virus. Something bizarre is happening. If we took New Jersey and New York out of the calculus, the United States would be doing comparatively well in COVID deaths, certainly compared to the hardest hit countries in Europe. And by the way, there were more revised projections from the COVID modelers today. Remember, we were terrified last month to hear numbers like 2.2 million deaths if we did no mitigation. Then it was 1 million. Then it was 240,000 Americans dying. Then it was 100,000. Then it was 80,000. Last week, I guess back to Monday, it was 68,000. And projected deaths due to COVID are now at 60,000. By the way, that's slightly fewer people than that we lost to pneumonia and influenza in 2017 and 2018. The 2017-2018 flu season, those numbers according to the CDC. Now remember, we were told we needed to bend the curve in order to prevent our hospitals from being overwhelmed. Well, now it seems that the goalposts have shifted. I warned about this last month. Elected officials are now keeping us shut down in order to, quote, defeat the virus.
We're going to get through this, and we will re-engage our economy when it's safe, but the last thing I want to do is to have a second wave here.
The order of events here, break the back of the virus, have a full or as close to full healthcare recovery as possible.
Again, you see what's happening? It's stop the overwhelming of the hospitals, with a noble goal. That obviously didn't happen, came close to happening in New York and New Jersey, but thankfully it didn't happen. They moved around resources, did a lot to make sure it wasn't overwhelmed. But this is all extremely confusing and frustrating, and to millions of Americans it's really demoralizing because they're glad the numbers are down, they're glad the hospitals weren't overwhelmed, they're mourning the people who've lost their lives, loved ones, family, friends. It's devastating, devastating. But they're also seeing their world collapsing around them in this continuing shutdown. There are far too many unanswered questions tonight. Too much about this doesn't make sense. An insistence of mostly liberal governors to keep states closed that have had comparatively low rates of mortality and that never came close to swamping the healthcare system, it's just pushing people to the brink. We're going to keep asking questions. Those are my thoughts at the end of Day 32, America in Shutdown. Joining me now are two doctors who've been thinking a lot about the regional disparities in the coronavirus outbreaks. Dr. Neil Elatrash is the sports medicine director at Cedars-Sinai Medical Center. He's also the team physician for the LA Dodgers and Rams. and Dr. George Saros, who's the Director of Cardiology Operations at Mount Sinai, Queens in Astoria. Dr. Saros, because you are in such a hot spot in Queens, I want to start with you. You recently wrote a piece suggesting that the airports are a big part of the explosion in Queens. A lot of the workers at the airports, a lot of Uber drivers, a lot of people live in close quarters with many people in apartments. But why might cities with huge airport hubs and crowded conditions in Asia, densely populated, not see the same troubling numbers as New York? Thoughts?
To be honest with you, so first of all, Laura, thank you for having me tonight. To be honest with you, I'm not so sure about the other countries and whether the recording of cases and deaths is very accurate. New York is a Western country, and we are extremely good in documenting all cases and watching mortality very carefully. Now, New York is very unique, and particularly Queens, in having the disease. Why is that? So number one is that we are close to JFK. There is no other borough in the United States that harbors two major airports, LaGuardia and JFK, in the same vicinity. The distance between the airports is minimal. So this, I think, played a particular and pivotal role in seeding, in inoculating the disease. I believe that many travelers came from Europe, having the disease, were not diagnosed, and spread the disease like fire in Queens. The reason that Queens suffered so much is because of its unique characteristics. So
So Queens got hit, the airport hubs, understood. But Dr. Elatrash, we had the first wave, really, from China coming into California. And there's a lot of virus swirling around California. A lot of close quarters, a lot of people, obviously 40 million people. But it's over 1,000 deaths compared to New York, 12,000 deaths, half the population. Thoughts?
So the issue is
I think that there's a lot.
Wait, hold on, it's Dr. Elatrash. Go ahead.
Sure.
There's a lot that we don't know regarding those statistics. You and many others have been pointing out that we really don't know the denominator. Unfortunately, our modeling and what we do know with regard to the statistics of what's happening both in Los Angeles and New York is we know that unfortunate part of the numerator, the number of deaths. We don't even know the death rate. We know the number of deaths. And so a lot of the models that we're using extrapolates and is based on the number of deaths, which is only one part of the calculation. We have no idea what the denominator is. So when we're trying to figure out what the difference is in how the virus is behaving between a place like California or Los Angeles and New York, we don't even know the correct data, let alone the science of how the virus is behaving, what kind of haplotypes or mutations there are and how that might be different. We don't have the correct data. So I think that the doctor is right on with saying that this is a big blind spot that we have.
No, it's a big differential, though. I mean, it's a tenfold differential between the coasts, which leads a lot of people to start asking questions about genetic mutations of this virus, Dr. Saros, given the fact that the virulence might be quite different between the coasts. It's going to take a lot more testing. But Dr. Saros, I want to get into very quickly concern about quote, non-essential surgeries not being done now in these COVID
Truth in Media, I'm Ben Swan, and on today's show, a Facebook fact checker has spent the last few weeks debunking articles about the coronavirus leaking from the Wuhan virology lab. Here's the problem. That same fact checker at one point worked at the lab. So what was she covering up? And is this exactly the problem with the so-called fact checkers over at Facebook? All of it today on Truth in Media.
and coronavirus statistics. Yes, I am here today to inform you, in case you somehow managed to miss it, that the models, projections, guesstimates, case fatality rates, infection numbers, and various other statistics that have been thrown at the public in the past few months to justify the shutdown of the global economy, the implementation of a draconian police state, and the rewriting of all social norms and rules has been a bunch of manipulated, phony hooey. But don't take my word for it. Take the word of the credentialed, respected, university-affiliated, published, peer-reviewed, white lab coat-clad experts who are the only people we're allowed to trust on these matters.
There is no evidence around that doing any of these antisocial separation or prohibition or whatever you call it has any effect on the epidemic. With one exception, it flattening the curve, what people try to do, is broadening it. And that means it takes more time. And if it takes more time, in the end, you are putting more people at risk because nobody can, for extended periods of time, follow these draconic strategies or measurements.
So while looking for a specific virus, for example, the coronavirus, you can examine the total population. What you will find is that presumably around 8 or 10% of the population will have some kind of virus that makes them sick. But if you examine medical practices, do your tests there to determine who is sick, then of course you would find a lot more positive cases. And if you examine hospitals and take samples there, then you would find even more corona-infected people. That is to say, depending on which proportions of the population you examine, whether it is the whole population, patients in the waiting room, patients in a clinic, or when you examine very ill patients in the intensive care unit that are about to die, you will expectedly find these 7 to 15% coronaviruses every time you do a test. However, if they die of the coronavirus or of another virus while just having also corona, that can't be determined for sure. So when you look at the death rates in Italy, you want to know where the tests have been taken, where and how have these few available tests been used. If they were used in a hospital on serious or terminally ill cases, then obviously the corona death rates rise.
But let's say that, and this is an entirely hypothetical scenario, that that new coronavirus was not detected. You know, no one had noticed it, and no one had found that this is a new entity. And eventually, it killed 10,000 people in the U.S. based on this presentation that you have respiratory distress syndrome, acute respiratory distress syndrome. Most likely, you would have counted that within the bin of influenza-like illness, which, as I said, is killing already 30 to 60,000 people. 10,000 more or less would be very difficult to pick. It would be well within the range of statistical noise. And probably no one would have noticed, or perhaps some experts would have said that this year influenza seems to have higher activity, and maybe give some advice to increase the vaccination rate. If it were 10,000 deaths, it's very likely that it would not have been noticed. People would not have paid attention. If there were some news story, as I say in my article, it would have attracted less attention than a game between two indifferent NBA teams.
First, I want to say that in 30 years of public health medicine, I have never seen anything like this, anything anywhere near like this. And I'm not talking about the pandemic, because I've seen 30 of them, one every year. It's called influenza and other respiratory illness viruses that we don't always know what they are. but I've never seen this reaction, and I'm trying to understand why. And I have to say, I really feel for my colleagues that are in public health practice. It's easy for me to sit in the armchair of my office and look at this and observe it and be critical or have ideas. But I really feel for them for three reasons. One is that the data they're getting is incomplete to really make sense of the size of the threat. We're getting very crude numbers of cases and deaths, very little information about testing rates, contagious analysis, severity rates, who's being hospitalized, who is in intensive care, who is dying, what are the definitions to decide if someone died of the coronavirus or just died with the coronavirus. There's so much important data that is very hard to get to guide the decision about how serious the threat is this. The other part is that we actually do not have that much good evidence for these social distancing methods. There was just a couple of reviews in the CDC Emerging Infectious Diseases Journal, which showed that although some of them might work, we don't really know to what degree, and the evidence is pretty weak. So the third problem is the pressure that is being put on our public health doctors and our public health leaders, and that pressure is coming from various places. The first place it came from was the Director General of the World Health Organization, when he said this is a grave threat and public health enemy number one. I've never heard Director General of the WHO use terms like that. Then at the announcement of the pandemic, he said he's doing it because of a grave, alarming, quick spread of the disease and an alarming amount of inaction around the world. That puts a huge pressure on public health doctors and leaders and advisors, and a huge pressure on governments. And then you get this, what seems like a cascade of decision-making that really puts pressure on countries and governments, provincial, states, to sort of keep up with this action that was, that Dr. Hoffman said that we're trying to avoid or should avoid, which is an overreaction. I don't know what's an appropriate reaction, but I do know that I'm having trouble figuring this out.
Doctor, I want to read for our viewers what the CDC says in part about how to count COVID deaths relating to that last issue we just raised. In cases where a definite diagnosis of COVID cannot be made, but is suspected or likely, like the circumstances are compelling with a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. So, doctor, what's the problem with that?
Well, in short, it's ridiculous. I spent some time earlier today just going through the CDC's manual on how to complete death certificates and the parts that were specifically written for physicians. And in that manual, it talks of precision and specificity, and that's what we were trained with. The determination of the cause of death is a big deal. It has impact on estate planning. It has impact on future generations. And the idea that we're going to allow people to massage and sort of game the numbers is a real issue, because we're going to undermine the trust. And right now, as we see politicians doing things that aren't necessarily motivated on fact and science, the public's their trust in politicians is already wearing thin.
Yes, we are constantly exhorted to listen to the experts and only trust the people who are the credentialed, accredited scientists working in the field, unless they disagree with the alarmist narrative, in which case they must be ridden out of the history books, airbrushed out of the picture, Stalin, Soviet Russia style. And that is exactly what has happened with the dozens of scientists, prominent researchers in relevant fields, who are stepping up to contradict the alarmist narratives that are being put forth right now. And in order to understand that these are not fringe lunatic quacks, these are accredited, credentialed, awarded, respected experts in their field, and all of the other things that we are always told to bow down before, these are those types of people. And in order to document that, I will put on the record a couple of great articles from off-guardian.org that I hope everyone has in their info arsenal. One is called 12 experts questioning the coronavirus panic, and the follow-up is called 10 more experts criticizing the coronavirus panic, and this involves scientists and researchers like Dr. Sucharit Bhakdi, a specialist in microbiology who was a professor at the Johannes Gutenberg University in Mainz and head of the Institute for Medical Microbiology and Hygiene, one of the most cited research scientists in German history. You have Dr. Wolfgang Wodarg, German physician specializing in pulmonology, politician, and former chairman of the Parliamentary Assembly of the Council of Europe, and incidentally, the person I've cited on many occasions as one of the people blowing the whistle on the swine flu pandemic scam of 2009. Dr. Joel Kedner, professor of community health sciences and surgery at Manitoba University, former chief public health officer for the entire province of Manitoba. Dr. John Ioannidis, who my listeners will be familiar with from the Crisis of Science, professor of medicine, of health research and policy, and of biomedical data science at Stanford. You have Dr. Yoram Lass, an Israeli physician, politician, and former director general of the Israeli Health Ministry. Pietro Vernazza, Swiss physician specializing in infectious diseases at the Cantonal Hospital St. Gallen and professor of health policy. Frank Ulrich Montgomery, German radiologist, former president of the German Medical Association and deputy chairman of the World Medical Association. I could go on and on and on and on, as I'm sure you get the picture. There are dozens and dozens and dozens of very prominent people who are speaking out against the panic that is being fomented on the back of the dodgy numbers and questionable science that is this pandemic panic. And while we're throwing names and important perspectives into this mix, I will point people also to the excellent series of videos, Perspectives on the Pandemic, that is being produced by Journeyman Pictures right now, featuring Dr. John Ioannidis, Knut Witkowski, and most recently Dr. David L. Katz, talking about different ways that the mainstream science that has been pushed, at any rate, on the back of this panic is demonstrably wrong, and demonstrably dangerously wrong. This isn't just a academic question of, well, how many zeros should we add to the total estimate of number of deaths? No, this is about what we should do in the event of this spreading panic. What